due to your eye
Yeah.
hurts.
But plenty good spots here in Florida, huh? Where'd you go?
Bascom Palm.
Yeah.
Okay,
Good spot.
great. Good morning. Thanks so much to everyone for joining me. I just had an opportunity to sit down with the top South Florida healthcare leaders in my district, and really the warnings that I heard are not only very troubling, but confirmed my worst fears. And I'll share some of their specific concerns in a moment, but I really want to just comment on the dangerous political climate that we're in right now. Because Republicans opted to shut down our government this week because they refused to negotiate with Democrats at all. The Speaker of the House, literally in the last 2 days of the fiscal year, when we were already scheduled to be in session, canceled the session and Republicans essentially went on vacation. Democrats in the House were there, ready to work, sitting at the other side of the negotiating table, waiting for them to help us avoid the crisis that they have caused, and the Senate was in session as well. I've never seen that in all the years I've been in Congress, where one side just literally leaves town and leaves Americans twisting in the wind. There are 15 million Americans who will lose their health insurance under the big ugly law and the Republican plot to gut affordable health care tax premium credits. And 20 million more will see their health premiums soar because Republicans refuse to extend those ACA tax credits. That is over 200,000 people right here in my district who will face a massive hit to their monthly budget or entirely their loss of coverage. Kaiser estimates that premiums will double for our families. Who can possibly afford that? Especially in Florida, where rent, utility bills, and grocery costs are still already on the rise. Everything is expensive already. And if you add skyrocketing healthcare costs that are currently affordable, but the Republicans will cause to be unaffordable, that just breaks the bank and as is a last straw for so many. These are healthcare hikes that are no joke. For example, a family of four earning $64,000 a year will see their premiums rise, this is in my district, will see their premiums rise by $2,500 annually, or a 182% increase. We must avoid this financial catastrophe. Polls show that Americans overwhelmingly want us to extend these Affordable Care Act tax credits and cancel the Medicaid cuts. It's not even a close call, but Republicans have refused to even sit down and discuss it for months. This is not a new issue. It's not a last-minute thing that was added to the agenda by Democrats. This is something that we have been pushing and talking about that was an absolute necessity for months. Instead, Trump's far-right administration now is targeting blue states for illegal funding freezes, and the Republican Coward Caucus in Congress is going right along with him. Plus, Trump's also using this shutdown to unleash unlawful, lawless layoffs of federal workers. This is hostage-taking. That is what the Republicans are doing. I mean, what they are doing is they're saying if Democrats don't just roll over and stop fighting to lower people's health care costs, then they're going to suddenly start firing thousands of federal workers, which is likely unlawful. That has never happened in a shutdown. And to suggest that that is something that is the reason that we should agree to step aside and stop fighting to reduce people's health care costs is an outrage. As a breast cancer survivor, I can tell you when one day you are the picture of health and the next day you're a cancer patient, and I have hundreds of thousands of people who wouldn't be able to do what I could do, which is when I found the lump myself 17 years ago, I was able to go right to a doctor because I had health care coverage. I was able to make sure that I got checked, and that's what confirmed that that lump was cancer. In the conversations I just had with healthcare leaders in my district, they were very clear that there were thousands and thousands of people in our community that will cease being able to do exactly what I was able to. And that is an unacceptable situation. It means people will go without health care. It means they will have to use the emergency room when they are only so sick that they have no other option. This is going to all end up in court, especially the thousands that Trump is saying he's going to fire. But that Republicans are just rolling over and letting him do it, and that they're so dug in that they won't focus with us as Democrats on lowering people's health care costs is mind-blowing. What Democrats are focused on is canceling the cuts, lowering health care costs, and saving Americans' health care. It is very simple that has to be part of the end-of-the-year spending discussions. What's worse is instead of defending families who are facing skyrocketing health care costs, our beleaguered federal workers, the Republicans in Congress are unleashing horrible lies. Rather than work with us as Democrats to fix their cruel policies, Republicans are carpeting Americans with the lies about undocumented immigrants and health care. Let me just be clear about what the truth is. Undocumented immigrants are not eligible for health care tax credits, and they are not eligible for comprehensive Medicaid coverage. It is already against federal law. They are lying. Not today, not last month, not tomorrow, not last year. Democrats aren't proposing to change either of those prohibitions. So this is baloney. When you don't have an argument to justify your really terrible position, you start lying so that you can distract people. Fact checkers from the New York Times, PolitiFact, CNN, AP have all debunked these Republican lies. But this corrosive, corrupt, and vengeful conduct that we're seeing in this latest Trump shutdown has chilled any type of decent dialogue on how to fix it. And it has other chilling complications. The leaders I just spoke with aren't standing here with me because they fear retribution. I mean, this is the first time in my career that I have had, and a lot of you cover roundtables of mine all the time. You know, I have a roundtable discussion, and then they join, the people I talked with join me in a press availability. But none of them were willing to come and stand here with me, even though they told me very serious, concerning things about the impact of these healthcare cuts on the patients that come to their facilities and that their doctors see, because they feel the threat of vengeance and retribution and the potential to lose their jobs. We have a very vengeful state government under Ron DeSantis and a very vengeful federal government. And so anyone who speaks out pays the price. That is scary. That is not the United States of America that I know and love, and it's unacceptable. So they don't want to harm their patients or their workers by publicly criticizing or questioning the wisdom of gutting our healthcare systems, which is what Republicans are doing, and it's what they told me that is happening. It's also why you don't see average people who count on these ACA credits standing here with me today, because they have jobs and they're worried about being public about the impact of these changes on their livelihood. I have 82,000 people who will lose health care coverage in my district because of Republican cuts to Medicaid. That's in the big, ugly law, and their plot to gut the Affordable Care Act. Another 203,000 to be exact, plus people here in our community who will soon see their premiums soar out of control. But they fear that speaking out about it will cost them a job or will get their boss or their family in trouble with some Republican federal, state, or state official or agency. That's the so-called free state of Florida that we live in. I'm sure you've seen it a lot and probably have trouble finding people to talk on camera as reporters. Let me share a little bit about what we're doing. I do want to just give you a few words in Spanish so that I can make sure that I'm clear to all of my constituents. Este cierre busca poner fin a la crisis sanitaria. Los demócratas luchan por proteger nuestra atención médica. Los republicanos necesitan negociar un acuerdo que proteja la atención médica de nuestras familias. This shutdown is about ending the healthcare crisis. Democrats are fighting to protect our healthcare, and Republicans need to negotiate a deal that protects our families' healthcare. That is the bottom line. So in this discussion, a lot of my worst fears were confirmed. It is very clear that the cost shifting will begin if these tax credits are not extended. You have numerous healthcare systems that have at least 20% of their patient base, that benefit and have health care through the Affordable Care Act and use those tax credits. Those tax credits are on a sliding scale. They apply to people who are, either at the federal poverty level or about 200% of it. And when those expire, that means that most of those people are going to have to go without health care, or you're only going to basically see the sickest patients who have to keep that health care and find a way to pay for it, that are going to be able to continue to go to see their doctor or to go and see and get care through the normal way without the emergency room at hospitals across this community. The other problem is that if they lose their care entirely, then there are thousands and thousands, tens of thousands of people who are not going to be able to see a healthcare provider at all until they are so sick that they have to use the emergency room. And this is, you remember, back to the times before the Affordable Care Act, when this was a much, much bigger problem, where people who had no other option would wait till a very late stage of their healthcare challenge, and they would have to go to the emergency room, and they are diagnosed at a later stage. Their healthcare situation is much more complicated and complex. It's much more expensive to treat, and much less likely that they survive. We also talked about how the impact disproportionately on cancer patients is going to be very significant. If we don't reenact these tax credits and we don't make sure that we cancel these Medicare cuts, then you're going to have a lot more patients who are not going to be able to get their cancer care, because cancer care primarily is elective. In other words, it's not done in the first place through the emergency room. It's done where you have a problem arise. It's found through a mammogram or a colonoscopy or some other screening, or the person's not feeling well and they go to the doctor, and then tests show that they have cancer, and then the rest of their treatment is outside the emergency room through the normal healthcare system. Well, someone without healthcare insurance coverage that is affordable is not going to be able to go through that process. So what happens is they will have a problem, or they won't be able to find that someone has cancer until the cancer grows so significantly that it causes an emergency that necessitates an emergency room visit. And people will literally die as a result of not being able to afford to get that intervention screening health care that is non-emergent. And that's only possible when you have health care coverage. Couple that, they shared with me, that you add the massive cuts of hundreds of millions of dollars in cancer research funding that the Trump administration is cutting. Trump is cutting hundreds of millions of dollars in cancer research, and that means that you're going to have a lot of research that doesn't get done, and researchers that are not going to be able to work alongside healthcare professionals in our hospitals and in the healthcare system because the funding has evaporated. What does that mean? It means that more cancers will go undiagnosed, and again, it will only be diagnosed when it is found much later through an emergency room situation. The other impact potentially is that a lot of our hospitals have affiliations with medical schools, and they have residents who round with trained doctors at these hospitals, and I was concerned about what the impact on those residents and the possibility of impacts of training the next generation of medical professionals. These cuts are real. The cuts that would impact the next generation of medical professionals mean that when you have a massive drop in the patient base that is showing up in these hospitals, if fewer patients are coming, then these hospitals are in danger of not qualifying to be able to train residents because they may not have enough of a patient base to do so. And you very likely have a situation where certain kinds of patients that would normally come through aren't there, and so that training is missed because you have a patient mix that doesn't offer enough variety for our residents. We really have to make sure that we extend these premium tax credits, that we cancel the Medicaid cuts, because the financial and economic impact on our healthcare system is going to be very significant. It means that there are programs in our community. It means that there are programs that will likely start to slow down their ability to see patients, and so Wait times, they shared with me, will be longer in many cases. Expansions are going to have to be slowed down so that wait times are longer. And hiring. You have a lot that, when you have major healthcare systems, they're constantly hiring. People move around, and when job opportunities open up for newly graduated residents, and those jobs are going to dry up when you have that significant, when you have 20 to 30% in some cases of patients disappearing from the hospital systems that we have here in the healthcare system. That's a huge financial impact. So I'm happy to take any questions.
Congressman, you made mention of the people who you feel who are concerned about coming out and speaking with you.
Mm-hmm.
Who were those folks?
Well,
no,
I'm really not able to share that with.
Right. In what capacity? Are those healthcare workers or?
These are healthcare leaders and workers who are the kinds of folks that I would normally sit down with when I'm trying to get feedback about the impact of healthcare policy in my district.
Some of those would be federal employees?
I'm not going to characterize the type of people we spoke to, but no federal employees.
And can you elaborate one more time as to their concerns?
Sure. The concerns, normally I would have, after a roundtable discussion like the one I just had, which was on healthcare policy, and the impact of the looming end to enhanced premium tax credits that reduces people's healthcare costs in the Affordable Care Act, as well as the cuts to Medicaid, causing 203,000 people to have in my own district, to have healthcare costs that skyrocket out of control. That's the reason I pulled together this roundtable, so I could get feedback from our major healthcare leaders in our healthcare system. And normally after a roundtable discussion like that, they would join me. Some of them would join me to be able to be available to comment and answer questions. And none of them were comfortable doing that, even though I assured them, as I'm doing now, that I wouldn't be specific. But none of them were willing to join me for fear of persecution, for fear of retaliation and the vindictiveness of of the DeSantis administration as well as the Trump administration, and the potential jeopardy that they would put themselves in, both professionally and personally.
You made mentions of programs slowing and wait times increasing, hiring slowing.
Right.
Where would that be happening?
Here in Broward County, across our healthcare systems, no matter what type of healthcare system we're talking about.
You also mentioned that Republicans claim that they don't reach an agreement because Democrats insist that they want to fund undocumented immigrants with their health care, which is something that has never been a topic discussed by you in the Congress. What can you clarify about it?
Republicans are lying when they say that the reason that Democrats are fighting to extend the premium tax credits is so that we can make sure that we can keep undocumented immigrants on health care. Undocumented immigrants are prohibited under federal law already from accessing these enhanced premium tax credits, and they are prohibited under federal law from participating in the comprehensive Medicaid program. That doesn't happen now. We're not proposing for it to happen, and they don't have an argument. So they have no valid leg to stand on. So instead, they are lying about what our motivations are, and they're being fact-checked and called out by the credible media. But they just keep repeating it because under the Trump administration environment, if you just keep repeating a lie, then people start to believe it.
Do you really think an agreement can be reached in the middle of all this?
I certainly hope so. I am trying to do everything I can to shine a spotlight on what the real impact would be on real people. I mean, we're talking about, I'll use myself as an example. I don't have premium tax credit because I wouldn't be eligible for them, but when I found the lump, when I was doing a breast self-exam in the shower, I was 41 years old. I knew what was normal for me. I knew when something felt different. A couple days later, I go get a mammogram and more screenings, and it turns out to be cancer. That wouldn't be possible for someone who loses their enhanced premium tax credits and can no longer afford to go to the doctor because they don't have coverage anymore. So instead, when I was diagnosed, I also found out I carried a genetic mutation that made it much more likely that I would get cancer in the first place and have it come back. If I didn't have the ability to go get that diagnosis, then I would be dead. I would have had cancer. It would have grown without my ability to learn that I had it. I would have not known that I was susceptible to ovarian cancer because of the genetic mutation that I had, and my life would have been cut short probably a little less than 20 years ago, eventually. That is what millions of people across this country are facing now because Republicans refuse to come to the table and negotiate in this end-of-year spending plan, ensuring that we can cancel these cuts, that we can keep health care costs low for these millions of people, and that we can save Americans' health care. This is and here's the thing. They're also saying that, well, we need to have that discussion after the government reopens, or they didn't want to close the government down. They didn't want to have that be part of the discussion because we can talk about that later. No, we can't. You know why we can't? Because premium notices, the re-enrollment, open enrollment for health care insurance is about to start. Those premium increases are starting to be mailed to beneficiaries already. And you can't, Trump is already firing people prior to this crisis that they've created. They already are cutting funding from cancer research, hundreds of millions of dollars in cancer research funding, all federal funding that Congress appropriated, and he's illegally making those cuts. We can't trust Trump. He's going to fire these people anyway. We can't trust that unless it is part of this spending agreement, they'll actually do what they say, because they don't do what they say now. So we have to be able to sit down now and have those discussions as part of this critical negotiation, because I'm sorry, I don't trust that in 7 weeks from now they're going to get to it and be willing to actually negotiate a real agreement that ensures that we allow people to be able to afford their health care. It is critical that we do this now. People can't afford to wait.
Lastly, I guess in about a week and a half, some members of the military will start missing paychecks. Other federal employees who are being forced to work without paychecks won't receive those. Again, this is all about a week and a half out. Mm-hmm. And so some are thinking that that's when there's going to be an agreement and Republicans and Democrats would come to the table. Is that something you subscribe to, or when checks stop showing up in the mail, that direct deposit?
I hope Republicans feel I hope there's something that causes Republicans to come to the table. We are, as Democrats, we're at the table. We have made clear that as part of the end of the year spending negotiations, we need to include making sure that people's health care costs do not skyrocket out of control, that people don't lose their health care. If you don't have your health, you don't have anything. That is something my parents taught me to understand, and I've experienced that firsthand. And I just heard from my own healthcare leadership in our community what the real life impact will be on thousands and thousands of people here in our community, hundreds of thousands really. You're going to have the emergency room be the most expensive primary access point for most people's health care who no longer will have affordable coverage or won't have coverage at all. And that's an unacceptable outcome that I am not willing to stand for, and that we have to make sure is part of these end-of-the-year spending negotiations. And Republicans are refusing to do that. They control all of Washington, the White House, the House, and the Senate. This is a Republican-owned shutdown, and all we have to do is sit down at the table to make sure that we are focused on making sure that people's health care is affordable and that we don't jeopardize people's health. Thanks, everyone.
Thank you very much.
Thank you.